All right, who is ready to venture out into this new year? Well, I'm not quite ready. Why? Baby, it's COVID outside, and I'm staying home. 2021 wrapped up with the U.S. surpassing more than 55 million COVID cases. That's since the start of the pandemic, with cases now surging to new peaks driven by the Omicron variant. Now, after last night, where friends and families gathered in small groups, we hope, but some of you probably gathered in some large groups. Will this lead us into another deadly surge? Dr. Farhan Bhatti, Michigan State lead for the Committee to Protect Healthcare and Family Physician in Lansing, Michigan, joins me now. Thank you so much for being here, Dr. Bhatti. I'm still here joined by my colleague, Dr. Jason Johnson. My question to you, doctor, is Dr. Fauci seems to think that the Omicron variant will peak at the end of January. We heard from leaders in South Africa that they have surpassed the wave and that it has already peaked there. One, do you agree with Dr. Fauci's assessment? And two, what should we brace ourselves for as the variant continues to ravage the country?
So good morning. Happy New Year to you. I certainly hope that Dr. Fauci is right. I'd like nothing more than to see this peak by the end of January, but we just don't know yet. The demographics here in America are quite different from that of South Africa, perhaps more like what we are seeing in the UK. And so we just don't know yet if it's going to peak and when. And what we do know is that our hospitals can't take much more of this, at least in some states, including my state here in Michigan. We are already near capacity. And so what we're afraid of is that by the end of January, our hospitals are going to be overrun with new cases.
Wow.
Dr. Bhatti, this is a concern of mine. Shout out to Michigan State Spartans. I was on a flight with a ton of Spartans yesterday leaving Atlanta to come to Washington, D.C. And one of the biggest concerns, and the reason that some of these flights are so filled, is because COVID, and in particular Omicron, is ravaging our travel system right now. And so many people who are already vaccinated are actually catching this new virus. My question to you is, with Omicron seeming to be the sort of king of breakthroughs, do we have concerns in the next 6 or 7 months that we might need another booster? Because if this evolves again, I'm beginning to be worried that what I have right now, that my 2 shots on my booster won't be enough for the next variant.
So I guess 2 things. Of course, we're going to need more boosters as we move through the process. It might be an annual deal like we do with the flu shot. It might be every 6 months. But let's not lose sight of the fact that the reason that this is spreading like gangbusters is not because of vaccinated individuals. It's because not enough people have gotten the vaccine in the first place.
Wow. So, Doctor, I'm curious. There is still so much confusion. The guidelines, I think, were a little confusing when they first came out from the CDC. 2 questions that I think are really important for the American people. One, I'd like you to talk us through the best types of masks. Dr. Leana Wen penned an op-ed in the Washington Post last week and said these cloth masks, essentially, they're just face decoration. So give us some insight on that. Also, a lot of people want to know, once you've contracted this virus, are you immune from catching it again? And if so, for what time period? Are you immune for the next 3 months, the next year? Talk a little bit about both of those, if you will.
Sure. So on the topic of masks, obviously the best kind of mask is one that's pretty much airtight. So like an N95 mask, that's not practical for most folks, especially children. So at the very least, a surgical mask that doctors wear in the hospital, like a small-sized version of those would be best for children and for adults, quite frankly, that are going back to the workplace. And I missed your second question.
The question of immunity. A lot of people want to know, if you've caught this virus, do you have immunity? Are you immune from catching the virus again? And if so, how long? Are you immune for 3 months, 6 months, a year?
So we think that it's 3 to 6 months. Of course, it depends on when you were infected with COVID and what strain. So if you were infected with COVID over a year ago with the alpha strain, you probably don't have any more protection than an unvaccinated individual at this point. But if you were sick with Delta just 2 or 3 months ago, you still have some built-up immunity. So it depends on the type of strain as well as when it happened. But what we also know is that the most robust kind of immunity that a person can have is one who got sick with COVID and then followed it up with a vaccine.
And Dr. Bhatti, I want to follow up with this idea of immunity, because it in my brain, in my non-doctor brain, right, it sounds like when you die in a video game and you come back and you're sort of immune for a while, nothing can touch you, right? And that seems to be going for 2 or 3 months. But the concern that I have is, when you are immune, does that also mean that you cannot spread COVID to other people? Because I've met folks who are saying, hey, I had it, so I can lick flagpoles and I can shake hands and everything else like that. You can't catch it, but can you still spread it when you're in that sort of immunity window?
Of course you can. That's how vaccinated people can spread it. When somebody coughs or breathes on you and they have COVID and you breathe it in, if you've been vaccinated or if you have some built up recent immunity, then the amount of virus in your system is much less than somebody who has no protection. But then you can still spread it onto someone else, even if you only get a runny nose or a slight cough, or even if you don't get any symptoms, you can still spread it on to other people. And because Omicron is so much more contagious than other strains, that's what makes it particularly worrisome.
Wow. Well, this is a conversation that we'll definitely continue to have. Dr. Badi, thank you so much for joining us this morning on the Cross Connection. We'll definitely have to have you back. And coming up next, it's a midterm election year, so the clock is ticking for Democrats to get things like voting rights done. Can they do it? I have two great lawmakers joining me on the other side, so keep it right here.